Hi, today I will be walking you through the steps on how to safely administer your injections of GLP-1 medication. My name is Philip and I'm the head nurse practitioner here at Regenics with over 10 years of nursing experience. Feel free to pause the video at any point to go at your own pace. Let's get started. Step 1 is to gather your supplies. This will include a sterile syringe, the vial of medication, and an alcohol swab. Be sure to wash your hands before preparing the medication. Step 2 is to prepare your injection. First, you will remove the cap from the vial of medication. You will then clean the top of the vial with an alcohol swab. Next, take your syringe and remove the cap. You will then draw air into the syringe equal to the volume that you have been prescribed. For example, if you have been prescribed 10 units of medication, you will drop 10 units of air into the syringe. You can then take the syringe and puncture the top of the vial. Next, you will inject the air into the vial in order to negate the vacuum. You can then invert the syringe and the vial together in order to drop the fluid. You will pull on the plunger gently in order to drop the right amount of fluid into the syringe. Again, if you have been prescribed 10 units, you will drop 10 units of fluid into the syringe. You can then remove the syringe from the vial of medication. If there is any residual air in the syringe, you can be sure to point the syringe upwards and flick the side of it to get any air bubbles to the top. You can then gently push on the plunger to eject the air, keeping the fluid in the syringe. Additionally, be sure that the tip of the needle does not touch any other surfaces during this process. Step 3 is to select your injection site. We recommend either the lower abdominal fat or the upper arm fat. For the lower abdomen, you'll select a site about 2 to 3 inches to the left or right of the belly button. For the upper arm, there's a fat pad located at the back of the upper arm. Gently stabilize the tissue by pinching it and then clean the site with alcohol. And now you're ready for your injection. Step 4 is to inject your medication. You'll take the syringe and gently puncture the skin with the needle, being sure to fully insert the needle into the fat tissue. You'll then gently push on the plunger on the syringe to inject the medication into the fat tissue. Once the medication is injected, slowly remove the needle from the skin. Step 5 is to safely dispose of your syringe. You can do this in a hard sharps container or something simple like a kitchen container or empty bottle of detergent. When these containers are full, you can bring them to a pharmacy to be safely disposed of. In the unlikely event that you notice any signs of infection, such as pain, redness, swelling, or warmth at the injection site, please seek medical attention at an urgent care facility. We understand that doing injections on yourself can be somewhat intimidating. However, we are here to support you, and if you have any questions or concerns, feel free to reach out to us.